Good morning, everyone. Today, I'm going to present regarding gynecomastia. This is a most common condition seen in majority of the male patients or male population. This condition, gynecomastia. I'm going to discuss regarding what are the symptoms, types of gynecomastia, causes, diagnosis, and finally the treatment options for gynecomastia. So the term comes from Greek word. As you know, gynec means female and mastos is breast. So it resembles a female breast. That's why it is called as gynecomastia. So gynecomastia is a condition where there will be an enlargement of male breast due to non-cancerous expansion of the both glandular tissue and fat deposition under the nipple areola complex. It occurs on one or both sides. So what is it? It's an enlarged breast tissue in male. It is a benign increase in breast volume due to an increase in glandular tissue. Obesity can also cause an increase in breast size due to excess adipose fat tissue. This is known as pseudogynecomastia. So when you see this picture, the pointer is not there. So on the bottom, you can see normal male breast, which is flat. But in case of gynecomastia, next to the pectoral muscles, there is an enlargement with glandular tissue as well as fat, which appears as female breast. This is a condition typically seen in case of gynecomastia. So you can see this picture. In normal male, it should be like flat chest, but in case of gynecomastia, it is a little bit enlarged and it is protruding. So there are different stages of gynecomastia. According to the tissue present, we stage them as stage 1, 2, 3, and 4. Types and stages of gynecomastia. There are 3 types like florid, fibrous, and intermediate gynecomastia. In case of florid gynecomastia, it is typically noticed in the early phases of the condition, like less than 4 months. An increase in ductal tissue and vascularity is seen during this period. And in case of fibrous gynecomastia, it is observed after 12 months of duration, which is characterized by more stromal fibrosis and few ducts. So it appears more hard and fibrous. The intermediate stage is observed between 4 to 12 months of duration, which is progression from florid to fibrous stage. So this is the classification of gynecomastia. It is classified as grade 1, 2, 3, and 4 based on the volume of the excess fat or gland present on the chest wall. So this classification is based on Simon grade of gynecomastia. Grade 1 is small breast without excess skin. Grade 2 is moderate breast without excess skin. Grade 3 is moderate breast with excess skin. And grade 4 is large breast with excess skin. There's one more classification as per Rorich, and this is graded as grade 1 is minimal hypertrophy, like less than 250 grams witauto ptosis, and grade 2 is moderate hypertrophy, in between 250 and 500 grams without ptosis, and grade 3 is severe hypertrophy, more than 500 grams with grade 1 ptosis, and grade 4 is severe hypertrophy with grade 2 or grade 3 ptosis. And based on the presence of symptoms, they are classified into 2 types, asymptomatic and symptomatic. So when you see this patient or male, you can classify it as gynecomastia or pseudogynecomastia. What are the differences? So the difference is mainly gland tissue and the fat. In case of pseudogynecomastia, we have more of fat and less of gland. But in case of gynecomastia, we have more of gland tissue and less of fat, as you can see in the picture. So true gynecomastia is the development of excess breast gland tissue. This is usually caused by hormonal imbalance caused between testosterone and estrogen. You'll find the presence of disc-shaped mass of rubbery firm tissue around the areola or behind the areola. So symptoms may include swollen breast tissue, tenderness in the area, and sensitive nipples. In case of pseudogynecomastia, it is the development of excess breast fat tissue mainly. This condition is not caused by hormone imbalance, but rather due to an excess amount of fat. You'll not find a mass around the area, around the nipple areola complex. Instead, you'll find a softer feel of more fatty tissue. It may change if the patient lifestyle is changed. So what is the prevalence? Gynecomastia is very common condition among males. So nearly 40 to 60% of male will be affected at some point of their lifetime. So most adult men with gynecomastia report no symptoms except for the presentation of swelling of the breast. It can affect people of all ages, but it usually occurs during the newborn period, puberty, and older adulthood. So about 50% of mid-pubertal boys experience gynecomastia of puberty, which is a common condition. Among those, more than 90% of cases resolve spontaneously within 24 months. Adults are more likely to have gynecomastia as they get older. In about 45 to 50% of cases, a thorough evaluation can find a cause of this population. So the incidence is 60 to 90% in neonates, and 50 to 60% in adolescents, and around 70% in older adulthood. So what does gynecomastia look and feel like? It typically looks and feels like a button-shaped growth underneath the nipple. One may be able to see this as a breast lump or feel it when you press on the area. The lump may move easily within the breast tissue and may be tender to touch. Breast lumps and enlargement may occur in one or both the breasts. In case of pseudogynecomastia, if the person have obesity, one may develop enlarged breast due to excess adipose tissue or overall fat. This looks like a general increase in breast size and not a lump. So what causes gynecomastia? The possible causes of gynecomastia is the enlargement of breast tissue. Estrogen is responsible for the growth of glandular breast tissue. Estrogen also suppresses the release of testosterone, as you know. And it's overall a imbalance between estrogen and testosterone levels is more likely to happen during periods of hormonal fluctuation. That's why we see during hormonal fluctuation, like in case of birth or during puberty, more of gynecomastia. So more than half of the newborn males have enlarged breasts or breast buds. It typically happens due to exposure to the birthing parent's estrogen levels. Gynecomastia in newborn usually goes away within a few weeks. So in case of what is teenage gynecomastia, this is seen typically in between 14 to 18 years of age due to hormonal fluctuation. So more than half of the adolescents have some degree of breast enlargement during puberty. It happens due to faster rise in estrogen than in testosterone, but this imbalance usually regulates with time, about 6 months to 2 years of time. In late adulthood, gynecomastia is common over 50 years, and unique factors contributing to this stage is testosterone levels naturally decline with age. This hormonal shift, coupled with relatively stable or increasing estrogen levels, create a conducive environment for gynecomastia to develop. People over 50 are also more likely to be taking medication that cause gynecomastia. So conditions that cause gynecomastia, it may be adrenal tumors, hyperthyroidism, or kidney diseases, Klinefelter syndrome, and some of the liver diseases and cirrhosis, male hypogonadism, pituitary gland tumors, or testicular tumors. These conditions typically have other symptoms, not just gynecomastia. So medication, some of the medications that cause gynecomastia are cimetidine, digoxin, finasteride, ketoconazole, spironolactone, thiazides, or other drugs like phenothiazine, theophylline, methotrexate, imatinib. Mainly substances including amphetamine and marijuana and heroin may also cause gynecomastia. Misusing anabolic steroids can as well cause gynecomastia in case of bodybuilders. So what are the symptoms of this gynecomastia? It is typically an enlargement of either one or both the breasts, painful nipple or tender formation, nipple sensitivity with rubbing against the clothes. And typically patients will have stooping down or bending of their chest because they cannot stand erect. They are not confident to stand straight, and they change the posture, and typically they wear loose t-shirts or loose clothing to hide that. the psychological effects of these gynecomastia are like in severe cases, they may cause depression, low self-esteem, and because of which they cannot go out and they cannot go to swimming pool or in public places because they need to hide the gynecomastia, which leads to anxiety, eating disorders, body dissatisfaction, obviously, because they are not happy with their shape or body, and they cannot go out freely, they cannot mingle with their friends, and reduced libido. So can this be prevented? Unfortunately, one cannot prevent many of the hormonal changes that cause gynecomastia. So if needed, one may reduce the risk of gynecomastia. In case someone is taking some medications, we can switch the medication so that at least the chances of getting gynecomastia are less. So if does gynecomastia go away? For newborns and adolescents, gynecomastia is usually temporary. It goes away once hormones rebalance. For a few people who have chronically low testosterone levels, gynecomastia may not go away without treatment. So can it be reduced with exercise? The answer will be typically no. If a person has gynecomastia due to obesity, weight loss may decrease it overall and contribute a little bit of decrease in the gynecomastia. If a person has gynecomastia due to hormonal imbalance, exercise likely won't make a difference because it's related with some other factors. So exercise, on the contrary, if persons go to gym, they do exercise, their pectoral muscles are increased, and it obviously pushes the gland forwards, and it makes it more obvious actually when you go to gym. So many of the people, they go to gym, and the gym instructors, they tell that you will reduce gynecomastia with this exercise, that exercise. They do more exercise, they build more of pectoral muscles, and contrary, it will show up more. Gynecomastia will show up more. So some of the few celebrities with gynecomastia, these are Indian actors. You can in that case, it is because of the anabolic steroids. When you use steroids, what happens is your estrogen testosterone levels imbalance happens, and typically the gland will grow up, and it shows obviously as a gynecomastia. You will not have a fat, but you will have typical gland. This is unilateral gynecomastia. The other guy, as I have explained, when you go to gym, what happens is it pushes more and more forward, and obviously the gland will be appearing more. So when you see this one, this is something like adolescent gynecomastia, which is treated, of course. And these are some of the few personalities who have gynecomastia. How it appears if you wear a T-shirt. So what are the imaging studies or the investigations which can be done in case of gynecomastia? You can go for ultrasound, you can go for mammography and testicular ultrasound in case if someone is having hormonal imbalance, and CT scan for adrenal deficiencies or whatever, and MRI of the pituitary gland. So what is the treatment for gynecomastia? Stopping or switching a medication which is causing the gynecomastia may decrease it. If a medication or substance is causing gynecomastia, switch to a different one or stop using it. So underlying condition treatment. If an underlying condition is the cause like a tumor or hypogonadism, treatment for the condition may also treat gynecomastia. So the definitive treatment of gynecomastia is surgery. Surgery is the only definitive treatment in case of gynecomastia, if it is proven that it is not caused by any other factors. So what surgery is needed? It's called male chest reshaping. It includes both liposuction as well as gland excision. We need to include both liposuction and gland excision. I will explain to you what happens if we do only gland excision and if we don't do liposuction. So in case of gynecomastia, liposuction we use for two purposes. One is to remove all the fat, and the second one is to disrupt the inframammary crease. If we don't disrupt the inframammary crease, what happens is the transition will not be smooth, and it will obviously appear as a stepladder pattern. So we need to disrupt the inframammary crease so that the transition will be smooth and the overlying skin will be covering the entire chest in a smooth way. So is this surgery permanent? Yes, once it is done, because we are removing the gland as well as the fat, usually if done properly, the gynecomastia surgery is permanent. You can see this before and after of an 18-year-old boy. This is gynecomastia. After the surgery, you can see the transition. It's smooth. There is no stepladder pattern because it is done both with liposuction and gland excision. So the chest wall appears smooth. You can see one more. This is a 45-year-old male. It's a huge, grade 3, 4. When done properly, like with liposuction and gland excision, the transition will be smooth and there is no stepladder pattern. You can see one more before and after. This is adolescent gynecomastia. Usually, we can do gynecomastia surgeries as early as 16 years of age, because that is the age when it impacts psychologically. So we can do it as early as 16 years also. So in case of skinny people, you can see huge difference gynecomastia after the surgery. So this one, a pivotal gynecomastia. We mark all the fat area. This is the gland which is removed with a small incision around the areola. You cannot see the incision also. And the liposuction, it is done from the axillary approach. So outside, when you see, there is no marks at all, no visible scars on the chest wall. And no one will know that he has undergone a surgery for gynecomastia. This is how typically the fibrous gland looks like. And this is the fat after the surgery. You can see some of the pictures before and after. This is more on right side, unilateral. Left side also is seen. So before and after, you can still see the stitches that will get dissolved, and there will be no marks, obvious marks after the surgery. You can see before and after. Right side is more, and after the gynecomastia surgery, the transition is smooth and it appears more manly. You can see many of the pictures like before and after. Smooth transition with liposuction and gland excision. This is grade 3, grade 2 and 1, grade 3. This is grade 4. We cannot do liposuction and gland excision, because if we do only liposuction and gland excision, we'll do that also. But if we do only liposuction and gland excision, what happens is the skin will sag down. So it produces a bad kind of result. So in this case, we need to go for excision and nipple grafting, free nipple graft. I'll show you how it is done. This is how we mark for grade 4 gynecomastia. We mark that area is excised, and we mark nipple area where the new nipple is going to be placed. This is how we remove the nipple graft. We take out the nipple graft first, and then we excise the breast tissue overall, and we suture it, and we place the nipple graft over there, which is marked. This is called full thickness graft, nipple graft. You can see before and after. If a person doesn't mind scar, then this is the good option in case of grade 4 gynecomastia. You can see the placement of nipples. Now it is very good, even, and chest wall is flat. So these are the markings for liposuction. Previously, we used to do from lateral aspect, infero-lateral or infero-medial aspect. Nowadays, we have switched to the axillary approach or through the nipple, so that nothing is seen outside. These are various areas from which liposuction is done: infero-lateral, infero-medial, trans-nipple or trans-areolar, and axillary. So I do majority of the cases through transaxillary liposuction. This is the infero-lateral aspect which liposuction is done, and gland is excised from that area itself. You can see trans nipple also. This one of the cases of trans nipple liposuction and excision. You can see the gland, and you can see that there is obviously no scar. This is one more case of trans nipple, grade 3 gynecomastia. The incision is only this, nothing else. So these are, you can see the transformation, there's a bulge or a C kind of thing, and now after that it is flat. So after 4 weeks, you can barely see the scar and even the liposuction scar. This is the way we extract the gland from the transnipple. This is areolar incision, post-op 3 weeks, and post 10 weeks, you barely see the scar. So this is the algorithm for gynecomastia. You need to do liposuction and perioral incision. Grade 1 is removal of the gland. Grade 2 is removal of the breast tissue, liposuction and gland. Grade 3 is removal of fat and gland. And if it is more, then we need to excise the skin. As I have shown, we need to excise entire skin and go for free nipple graft. So what happens if you don't include liposuction? A crater deformity is an indentation or depression in the chest wall that can occur after gynecomastia surgeries. Previously, when we were not including liposuction, or many of the general surgeons, they were doing it, gynecomastia surgery. What happens is they just remove the gland and they don't care about the surrounding fat. In that conditions, typically this crater deformity is formed. It is caused by removal of only gland without liposuction or fat removal of the surrounding area. The result is an uneven chest wall with an unsightly appearance. You can see this one. When only the gland is removed without liposuction, it forms an unsightly this one with a crater in the nipple areola complex. So we need to definitely include liposuction in case of gynecomastia. Always gynecomastia should include liposuction and gland excision together, except for professional bodybuilders. In case of professional bodybuilders, they will not have much fat. They have only gland. And I will show you some of the pictures of the bodybuilders. So in case of bodybuilders, the cause is different. So when gynecomastia appears in bodybuilders, it's typically caused by use of anabolic steroids. And this occurs due to body's attempts to remove circulating testosterone in response. So one of the byproducts is estrogen, and it is called aromatization. So that causes typical increase in the only gland tissue without fat, and it causes emotional impact on bodybuilders like mental discomfort, deterrent to competing, frustration, loss of motivation, and hiding physique. So when we do the surgery, obviously they will regain the competitive edge, and gynecomastia surgery is recognized as the gold standard treatment for effectively addressing true gynecomastia, where other methods fall short. For bodybuilders and competitive athletes, this isn't just about aesthetic improvements, it's about reclaiming the ability to compete at the highest levels without the burden that gynecomastia can impose. So these are some of the bodybuilders. They typically have only the gland and their fat tissue is very less. So when we do the surgery, they can compete with confidence. So this is one of the bodybuilders. These are all professional. This is how the gland looks like when we take out gland. In case of gynecomastia of bodybuilders, they don't have much fat, and the gland is very, very thick, very fibrous. It's and we expect too much of bleeding because they are on anabolic steroids. So this is the way right and left gland looks. One more professional bodybuilders. These are all professional bodybuilders where we remove only the gland. In these cases, there is no need of liposuction. This is before and after picture of competing bodybuilders. This is one more. This guy, I have done in some 2 years back. He has won an international competition. He's Bahraini bodybuilder. So life after gynecomastia surgery, it will have a tremendous impact on your physical and psychological also. So after gynecomastia surgery, improved self-esteem and confidence is there, and it creates a masculine physiques, and definitely the posture will be improved because previously they need to hide the gynecomastia by loose clothing, or they always pull their shirt and they just tend to bend down because of the obvious show of gynecomastia. The posture will improve. and it's permanent removal of excess tissue, so the confidence levels also improves. And more clothing options, they can go for skin tight t-shirts and all, and they need not hide their gynecomastia. It helps in maintaining a healthy weight, and the procedure is very quick. It takes around less than 1 and 2 hours, and the scars are invisible. Recovery is very quick. So the points to remember are: surgery is the standard treatment for gynecomastia. Most commonly used technique is the direct resection of glandular tissue using periareolar or transareolar approach with liposuction. The procedure is simple, 1 to 2 hours, and is a day case, and recovery is typically within a week. Thank you.